Welcome to Vitals and Veins, where we break down the real work behind patient care, built for medical assistants, phlebotomists, and EKG technicians, from students working toward certification to seasoned pros keeping their credentials current. This podcast is for those committed to doing the job well at every stage of their career. Let's get into it. I'm your host, Nichelle.
And I'm Kirsten.
I'm really glad we're talking about this topic today because I think it's one of the most overlooked parts of occupational exposures in healthcare.
Completely. Because when exposures get discussed in training, the conversation usually focuses almost entirely on protocol.
Right. Wash the area, report the injury, follow exposure procedures, and complete follow up.
Very procedural, robotic.
Yeah, exactly. But what often gets left out is the actual human experience of going through an exposure event.
Which can be much more emotional than people expect.
Yeah, even for experienced healthcare workers. Yeah, I think that surprises people because healthcare workers are trained to stay calm and stay professional and keep moving during stressful situations.
But internally, there can be a lot happening, I
A
feel.
lot, yeah. Anxiety, uncertainty, embarrassment, self questioning.
And what makes this harder is I think people underestimate how quickly an exposure suddenly becomes personal.
Exactly. 1 second, you're performing a routine task.
And the next second, you're the one potentially at risk.
Yeah. And that shift can feel really unsettling emotionally.
Which almost makes it even stranger sometimes.
Yeah, because something familiar suddenly feeling unsafe. Whew. I mean, the reality is, I think healthcare workers sometimes downplay how stressful these situations actually are.
Oh, I completely agree. Because exposures are often treated culturally like, well, this is just part of healthcare.
Right? And while exposures do happen in healthcare,
That doesn't mean the emotional experience is insignificant.
right, 100%, like what makes this harder, there's often this unspoken expectation that healthcare workers should just handle it and move on quickly.
Especially in these busy clinical environments. And healthcare workers are often very good at hiding stress externally.
Sometimes too good.
Definitely too good sometimes.
I think one of the hardest parts for many people isn't even the initial injury itself.
Oh, it's probably the waiting afterwards.
Absolutely. The waiting afterwards is the worst. Because once the immediate response is over, there's often this strange period where everything becomes uncertain.
Oh, yeah, waiting for labs, waiting for follow up, waiting for communication, waiting for answers.
And even when the actual clinical risk is low, uncertainty can still feel emotionally very heavy.
Especially if communication during that process is inconsistent, I feel.
Completely, yeah. I think that waiting period is something healthcare education barely talks about at all. Because the clinical process may technically be moving forward correctly,
But emotionally, the person may feel completely stuck in limbo. I think the waiting period after an exposure is something people outside of healthcare probably don't fully understand. From the outside, it can seem very straightforward. The injury happened, the protocol was followed, and now you just wait for the process to play out. But emotionally, it rarely feels that simple. Nichelle, I'd really like to hear your thoughts on why waiting periods can feel so heavy for healthcare workers, even in situations where the actual clinical risk may be very low.
well, I think uncertainty is one of the hardest things for humans to sit with in general. And exposure creates a very specific type of uncertainty because suddenly your own health becomes part of the situation. One moment you're functioning entirely in a caregiver role, and then suddenly your brain shifts into, what if something happens to me?
Sure.
Even when healthcare workers understand the statistics and know many exposures ultimately carry a very low transmission risk, uncertainty still affects people emotionally. Because stress is rarely driven by statistics, it's driven by anticipation, possibility, fear of the unknown, and the feeling that something important is unresolved. But now that there's this period where the situation technically continues in the background, there may still be follow up testing and lab work, source patient information, occupational health communication, or waiting for final clearance. And psychologically, that can leave people feeling stuck in this strange middle space where daily life is continuing normally, but mentally, part of them is still attached to the exposure event.
That's exactly how I think a lot of people experience it. Because outwardly, they're still functionally normally. They're still working, they're still taking care of patients, still moving through the day. But internally, they may be replaying that exposure over and over and over again.
Exactly.
There's almost this pressure to look calm, even if internally you feel unsettled.
And communication becomes incredibly important during that time. Clear communication can dramatically reduce the emotional weight of uncertainty. Because when people understand what happens next, when follow up occurs, what timelines look like, and who they can contact with questions, the situation, it starts to feel more structured and manageable.
Even small updates can make a huge difference.
Yeah.
Sometimes people just need reassurance that the process is still moving forward.
Exactly. Silence absolutely magnifies anxiety. And I think that this is one area where organizations, sometimes unintentionally, focus only on the clinical process while overlooking the emotional experience happening alongside it. From a procedural standpoint, everything may technically be handled correctly. But from the employee perspective, the experience can still feel uncertain or even unsupported if communication is inconsistent.
Yes, especially if there are delays or gaps in follow up.
Right, yeah. A few days without updates can feel much longer emotionally when someone is already stressed. That was something I experienced very strongly during my own experience. Clinically, the situation was initially presented as manageable, but the uncertainty stretched out much longer than I expected because the source patient had agreed to testing and then never actually went into the lab.
Mm-hmm.
Employee health kept trying to contact them, and eventually they stopped returning calls. So instead of getting closure quickly, the process dragged on for weeks.
Yeah.
And what surprised me most was how much mental space that uncertainty started occupying. I found myself constantly checking for updates, checking messages, checking portals, wondering if results had finally come through. And after a while, every communication from employee health started carrying emotional weight.
Mm.
Like even seeing a phone call or a message notification would immediately spike my anxiety because my brain instantly assumed this must be the bad news.
Yeah. And I think that really shows how uncertainty changes the emotional meaning of communication itself.
Exactly. Even routine follow up started feeling emotionally loaded. At one point, there was even a false positive scare during the process.
Oh,
And even though I understood intellectually that false positives can happen, hearing that possibility, even briefly, completely shifted the emotional atmosphere of the
that's
situation.
terrifying. Yeah.
Yeah, because suddenly your brain starts racing ahead of the actual information.
And I think healthcare workers are especially vulnerable to that kind of spiraling uncertainty because we understand enough medically to imagine possibilities very vividly sometimes.
That is such an important point. Clinical knowledge can sometimes make uncertainty feel even more emotionally intense.
And sometimes the things that help most are actually very small. Simple check ins, clarifying next steps, making sure someone understands the timeline.
Oh, yeah, those things matter enormously psychologically, especially because exposures can feel very isolating. Everyone else's day may continue normally while the exposed healthcare worker is quietly carrying that uncertainty in the background the entire time.
Mm.
And one of the hardest parts about uncertainty is that there's no immediate emotional endpoint. You don't instantly know how worried you should feel, what the outcome will be, or when the situation will finally feel fully resolved.
For sure, humans really struggle with unresolved situations emotionally. I know I do.
Yeah, ditto. Especially situations involving health uncertainties.
Mhm.
So, one thing that surprised me personally after my own exposure was how the uncertainty started affecting my thinking in ways that didn't even fully make logical sense to me at the time. Clinically, I understood the exposure process, I understood transmission risk, I understood how follow up worked, but Emotionally, the experience still changed how I felt in my own body for a while.
Mm.
And this is something I don't think healthcare workers talk about very often because it's difficult to explain unless you've experienced it yourself.
Mhm.
There was a period where I felt almost unclean somehow,
Mm.
not rationally and not scientifically, but emotionally. Like suddenly I was the potential risk instead of a caregiver.
Mhm.
Even though I knew logically that didn't align with the actual clinical reality of the situation, the feeling was still there underneath everything.
That makes so much sense to me, though, because exposures suddenly shift healthcare workers out of the role they're used to occupying.
Yeah, exactly. Healthcare workers spend so much time thinking about protecting patients,
Mhm.
maintaining sterile technique, preventing contamination, and then suddenly, after an exposure, your brain almost turns those same fears back toward yourself,
Yes.
which was a very strange emotional experience because intellectually I knew the situation was still being evaluated. But emotionally, there was this lingering feeling of what if I'm somehow unsafe now?
Mhm.
And I think stigma plays into that much more than healthcare workers sometimes realize.
Especially because certain infections still carry such strong emotional and social associations, even in clinical environments.
Exactly, it's true. I think one reason these conversations matter is because healthcare workers sometimes assume that having medical knowledge should completely prevent emotional reactions like that. But humans don't stop being emotional simply because they understand the science. You can fully understand the statistics and still experience uncertainty emotionally. Those things absolutely coexist.
And I think hearing people talk openly about that side of the experience probably helps reduce shame around it too.
I hope so, because one thing that surprised me was realizing how many emotional reactions can exist simultaneously after an exposure: fear, embarrassment, hyper awareness, self questioning, and eventually even anger. And none of those reactions changed the fact that I understood the clinical reality of the situation. They just made me human.
Yeah.
And experiences like that really change how much about the emotional side of an exposure, follow up, and support are. Because supportive communication does more than just provide information, it changes how manageable the experience feels.
I also think one thing healthcare workers don't always talk about openly is how much emotional masking happens during situations like this. Because outwardly, people may look completely composed while internally they're struggling quite a bit.
I think that's very true. And I noticed that in myself afterward too. I continued working normally after the exposure, but internally I felt very different than I probably appeared. I became much quieter socially at work, more isolated, much more focused on just getting through tasks and staying mentally controlled. And I think part of that was me trying very hard to remain clinically objective about the situation because healthcare workers are trained to think critically, stay calm, and approach situations logically. So when emotional reactions start happening, they can almost be this pressure to suppress them.
Yeah, especially because healthcare culture often equates composure with professionalism.
Exactly. And I don't even know that the pressure always comes directly from other people. Sometimes it becomes internalized. Like you feel as a healthcare worker that because you understand the science, you should somehow be emotionally unaffected by the experience too.
Mhm.
But those are not actually the same
Yeah.
thing. You can understand the clinical reality of a situation and still struggle emotionally while living through it personally.
And I think healthcare workers sometimes judge themselves pretty harshly when those emotional reactions happen.
Very harshly.
Mhm.
Because this expectation exists that being medically knowledgeable should automatically make you clinically objective all the time.
Mhm.
And personal experiences don't really work that way. And when something happens to you, it stops feeling theoretical very quickly.
Mhm.
And I think a lot of healthcare workers end up trying to hide that internal struggle because they don't want to appear irrational, overly emotional, or unable to handle the situation professionally.
Even while they're still carrying a huge amount of stress just from that internally.
Exactly. I think that emotional compartmentalization becomes so normalized in healthcare that people stop recognizing how exhausting it can actually be. because outwardly you're still functioning, working, caring for patients, still completing all your responsibilities while mentally carrying the uncertainty and stress in the background the entire time.
Mhm.
One thing I noticed afterward was that I became much more vigilant overall, not panicked, just hyper aware,
Mhm.
more aware of sharps, more aware of hand placement, more aware of potential risk points during procedures, which makes sense psychologically after something like that,
Mhm.
but it also showed me how much stress can continue affecting behavior quietly, even when somebody appears completely composed externally.
And I think a lot of us healthcare workers listening will probably recognize themselves in that experience.
I think so too, because healthcare workers are often very good at looking functional while struggling internally,
Mhm.
and those are not always the same thing. Another thing that can intensify stress during exposures, even when the clinical risk is low, is the stigma people still associate with certain infections.
Especially infections that carry a lot of historical fear or social misunderstanding attached to them. I think stigma still affects healthcare workers more than people sometimes realize, even in environments where we understand the science and follow evidence based practices. Certain diagnoses still carry a strong emotional reaction. Nichelle, I'd really like to hear your perspective on why there still can be such a gap between clinical understanding and emotional response in these situations.
Yeah, thank you. I think part of that is the emotional associations are often much older and much deeper than clinical knowledge. Healthcare workers may fully understand how transmission works and what the actual exposure risks are and how modern treatment and prevention have evolved. But emotionally, certain infections still carry years of cultural fear attached to them, especially infections like HIV or hepatitis.
Yeah.
So during an exposure event, even if the actual transmission risk is very low, those emotional associations can surface very quickly because suddenly the situation feels personal. Instead of discussing a disease process abstractly, the healthcare worker is now imagining themselves connected to the possibility of that diagnosis in some way.
And I think people sometimes feel conflicted about having those fears because they know scientifically what the risk actually is.
Exactly. There can almost be this internal pressure to react perfectly rationally
Mhm.
because of their medical background. But emotional reactions don't always operate on pure logic.
Especially because exposures create a situation where uncertainty leaves room for imagination.
Right, yeah. And healthcare workers have enough medical knowledge to picture possibilities very vividly, even when those possibilities are unlikely. That's one reason uncertainty can feel especially intense in healthcare settings.
And for some people, the fear extends beyond just the medical side of it, too.
Absolutely. Sometimes people worry about privacy, future implications, relationships, career concerns, or how others might react. And stigma often works quietly. It's not always something people openly verbalize, too. Most healthcare workers are not going to directly say, I'm afraid of the social meaning attached to this. But those emotional undercurrents can absolutely influence how exposures feel psychologically.
Particularly during the waiting period when there are still unanswered questions.
Exactly. Again, uncertainty tends to amplify the emotional thinking. And when people are stressed, the brain naturally starts searching for potential outcomes, usually the worst ones first. That becomes even stronger if someone already has powerful emotional associations tied to a certain diagnosis.
I also think healthcare workers are still influenced by larger cultural messaging, whether we realize it or not.
Completely. Yeah, healthcare professionals are still people living inside of a broader society. They've grown up hearing public messaging, media narratives, historical fear, and social stigma around certain illnesses for years. Clinical training adds knowledge, but it doesn't instantly erase emotional conditioning.
And some infections still carry emotional weight that goes far beyond the actual clinical exposure risk itself.
Exactly. Which is why exposure support needs to address more than just the procedural side of the event. Because if someone is frightened or emotionally overwhelmed, simply repeating statistics may not fully help them process what they're experiencing.
That's such an important distinction because reassurance isn't just about giving information.
Right. It's also about helping someone feel supported while they move through uncertainty. And I think healthcare environments sometimes become so focused on technical accuracy that they unintentionally overlook the emotional side of the experience.
For sure, especially when fear or stigma are involved.
Exactly. Something else that's important here is that stigma can also shape behavior after exposures happen.
Definitely. If someone feels shame, fear, or embarrassment connected to possible outcomes, that can influence how openly they respond to the situation.
Absolutely. People may minimize what happened, delay reporting, avoid conversations, or emotionally distance themselves from the experience because it feels psychologically uncomfortable. And shame often increases silence.
Yes, which becomes a major problem in healthcare environments.
Very much so. Because safety systems depend on transparency. And one thing that a strong workplace culture will do really well is reduce fear around these conversations. They create environments where people can ask questions, report exposures, and seek support without feeling judged.
Which really ties back into psychological safety again.
Completely. People function very differently in environments where they feel emotionally supported. Communication improves, concerns get raised sooner, and questions get asked earlier. And overall, safety becomes stronger because transparency feels safer.
Whereas fear and shame usually push people towards avoidance.
Exactly. And healthcare systems work much better when openness feels safer than silence. Another important part of this conversation is the reality that not every exposure actually gets reported.
And that's something healthcare has struggled with for a very long time. I think a lot of people would probably be surprised by how many exposures actually go unreported in healthcare. Because from the outside, it seems like something everyone would immediately report without hesitation. Nichelle, I'd really like to hear your thoughts on why underreporting still happens so consistently, even when healthcare workers understand the importance of exposure protocols.
Well, I think underreporting usually comes from multiple pressures layering together at the same time. Rarely is it just one reason. Sometimes it's embarrassment, sometimes it's workflow pressure, or paperwork, or time constraints. Sometimes people convince themselves the exposure was too minor to really matter, and often those things all overlap together. One thing I think healthcare workers become very skilled at is mentally prioritizing tasks under pressure. This is a good thing.
Mm-hmm.
In busy clinical environments, people are constantly deciding what absolutely has to happen right now.
For sure.
And unfortunately, exposures sometimes get mentally downgraded in the middle of everything else happening around them, especially if the injury initially feels small.
And healthcare workers are already so used to pushing their own needs aside.
Exactly. Skipping meals, skipping breaks, delaying bathroom trips, working through exhaustion. The mindset becomes very normalized in healthcare culture. So, when an exposure happens, a lot of people instinctively think, I'll deal with this later. Not necessarily because they don't care, but because they're trying to keep everything else moving.
Especially during chaotic shifts where everyone already feels super overwhelmed.
Right, yeah. And I think people outside healthcare sometimes underestimate how emotionally difficult it can feel to step away from the workflow in those moments. Healthcare workers know their coworkers are busy too.
Mm-hmm.
So there can be guilt attached to interrupting the day, leaving the floor, or creating additional work for other people.
Even though reporting the exposure is absolutely the correct thing to do.
Exactly. Intellectually, people know the protocol, but stress changes behavior. And another thing that strongly influences reporting is social perception. People worry about looking careless, being judged, or feeling like they made a mistake, especially experienced healthcare workers.
Because experienced staff often hold themselves to extremely high standards.
Very high standards.
Mhm.
And when exposures happen during routine tasks, people sometimes replay that situation over and over in their head, thinking, I should have caught that. I should have slowed down. I know better than this. Even though logically I knew there had been a puncture and bleeding, I still found myself mentally replaying the moment over and over, trying to minimize what happened,
Mhm.
thinking maybe it didn't actually break the skin. Maybe I overreacted. Maybe it wasn't as significant as I initially thought. Which is such a strange experience because intellectually you know what you saw,
Yeah.
but emotionally, part of your brain is trying to reduce the threat
Mhm.
enough to make the situation feel less overwhelming.
And I think us healthcare workers probably do that much more often than people realize.
Oh, yeah, I think so too. Because minimizing can sometimes feel emotionally easier than fully accepting that an exposure actually happened, especially when you're still trying to function professionally and continue working around other people like everything is normal.
And once embarrassment gets involved, avoidance becomes much easier psychologically.
Exactly. Humans generally don't become more transparent when they feel ashamed. They usually become quieter,
Hmm.
and unfortunately, silence weakens safety systems. Because exposure reporting is not just about the individual person, it's also about how organizations identify patterns, improve workflows, and strengthen prevention efforts overall.
And I think some healthcare workers also underestimate exposures because they've seen them happen so often over time.
Yeah, that's a really important point. Normalization plays a huge role in healthcare culture. When people work in a high pressure environment long enough, repeated exposures to risk can start to feel routine. And routine situations often stop triggering the same emotional urgency. So people begin saying things like, oh, I barely broke the skin. It's probably nothing. I've seen worse.
Mhm. And sometimes coworkers unintentionally reinforce that minimization too.
Absolutely. Even comments meant to reassure someone can sometimes normalize underreporting.
Hmm.
Things like, oh, you're probably fine and I wouldn't worry about it, happens all the time,
Yeah.
which may sound comforting in the moment, but can also discourage people from following through with proper reporting.
Oh, for sure, especially newer healthcare workers who are still figuring out what's considered normal behavior.
Exactly. New staff watch experienced staff very closely.
Hmm.
They observe what gets reported, what gets minimized, how leadership reacts, and how coworkers respond during stressful situations. What's important here, workplace culture often teaches behavior more powerfully than policy manuals do,
Because culture is what people actually experience day to day.
right? And if healthcare workers repeatedly see exposures treated casually or dismissively, that gradually shapes how safe or unsafe certain behaviors start feeling socially. Another factor that contributes to underreporting is operational friction. If the reporting process feels confusing, time consuming, or difficult to navigate during a busy shift, people become more likely to delay it.
For sure, especially when somebody already feels emotionally stressed or uncertain about that situation.
Exactly.
And I think underreporting becomes dangerous partly because it develops gradually over time.
Very gradually sometimes. Unsafe culture rarely appears all at once. It usually develops through repeated small moments, delays, minimization, normalization, and silence. And eventually, those patterns become embedded into workplace behavior. One thing my own experience changed for me significantly was how I viewed preventable risk in healthcare environments. Because after the initial fear and uncertainty settled down a little, one of the emotions that became much stronger for me was frustration. Not just frustration about my injury itself, frustration around the workflow surrounding it. Before the exposure happened, I had already felt uneasy about the process we were using during certain tissue procedures.
Mhm.
The biopsy specimen would be placed onto a slick plastic tray, and the physician would identify a specific location on the tissue using a temporary pin before the specimen was later sutured and sent to pathology. Years earlier, that pinning process had been safer because the specimens were stabilized using a wax barrier that secured the pin in place. But once that wax support system was removed and the protocol changed to require sutures before the specimens were sent to the lab, the workflow became much more awkward operationally. Now the pin was being temporarily placed into tissue sitting on a slick plastic surface without that stabilization underneath. And even before my exposure, the process already felt clumsy to me.
So even before the injury happened, part of you already recognized that the process itself felt less safe.
Exactly. And what became frustrating afterward was realizing that there was actually a very realistic way to remove this temporary pin step altogether. Because the specimen ultimately needed a suture placed anyway before it was sent to pathology. So, my suggestion was instead of temporarily placing a pin and then replacing it later with a stitch, why not place the suture immediately in the physician indicated location during the procedure and eliminate this temporarily placed pin, which would have removed that entire exposure point altogether.
And that's such an important distinction because now we're not just talking about individual caution anymore. We're talking about workflow design.
Exactly. Because sometimes healthcare conversations focus so heavily on individual responsibility that we overlook how much systems and workflows influence risk exposure. And what stayed with me emotionally afterward was the resistance to changing the process because the safer workflow was viewed as taking too much time, which was difficult for me psychologically after the injury because suddenly the situation no longer felt completely unavoidable, it felt preventable.
For sure, something that's preventable, I think that changes the emotional experience significantly. Because now there's frustration layered on top of the fear and uncertainty.
Very much so. And I think experiences like that can really change how healthcare workers view workflow shortcuts, provider urgency, hierarchy, and organizational safety culture overall. Because you start recognizing how often healthcare environments quietly normalize in the name of efficiency. And not because people necessarily intend harm, but because speed, workflow pressure, and convenience slowly became prioritized over time. And what really stayed with me afterwards was realizing how dangerous it can be when organizations start viewing certain risks as acceptable enough simply because they've become routine.
Especially because once a risky process becomes normalized, people can stop recognizing how unsafe it actually feels operationally.
Exactly. I think there's one reason these conversations matter so much is because healthcare workers adapt incredibly well to stressful and inefficient systems, sometimes so well that preventable risks stop standing out until somebody finally gets hurt. And by that point, the emotional experience becomes much bigger than just a physical injury itself.
Which is why leadership and organizational response matter so much.
And that really brings us into one of the most important parts of this entire conversation: the role leadership and workplace culture play in shaping how exposures are handled day to day.
Because policies alone don't create safety culture, people do. I think leadership and workplace culture influence exposure reporting much more than organizations sometimes realize. Because even if the policies technically exist, people are still paying attention to how those policies actually feel in practice. Nichelle, I'd really love to hear your thoughts on what psychological safety really looks like in a healthcare environment.
Well, to me, psychological safety is the feeling that you can speak up, report concerns, ask questions, or admit mistakes without immediately fearing humiliation or punishment.
For sure.
One thing that stayed with me after my own experience was how visible the situation suddenly became socially. My manager was gathering details about the incident in front of my coworkers and the physicians. So almost everybody around me knew what had happened very quickly. And even though the intention may not have been harmful, it added another layer of stress because suddenly the exposure no longer felt private, it
Mhm.
felt public.
Healthcare workers are often already judging themselves pretty harshly internally after something like
Yeah,
that.
exactly. So, even subtle feelings of exposure, scrutiny, or public discussion can amplify shame and self consciousness very quickly.
For sure. And I think that's why leadership response matters so much. So much during these situations.
Yes. And what's interesting is that workplace discouragement is often subtle rather than overt. Most supervisors are not openly telling people don't report exposures. Instead, it shows up through tone, frustration, annoyance, body language, or even comments that make the person feel like they've created a problem.
Even small reactions can completely change how supported someone feels.
Absolutely. If somebody reports an exposure and the response feels calm, procedural, and supportive, that reinforces safety behavior. But if the response feels irritated, dismissive, or questioning, people remember that too.
Oh, yeah, definitely, because healthcare workers talk to each other constantly about these
All
experiences.
the time. People know very quickly whether reporting an exposure in a workplace feels safe or whether it feels like an inconvenience.
For sure, because new healthcare workers learn culture mostly by observation.
Exactly. They watch how mistakes are handled, how exposures are discussed, and whether leadership stays supportive under pressure, and whether staff feel comfortable speaking openly,
Because culture is what people actually experience emotionally every day.
right? And one thing I think strong leaders do very well is separate human error from personal worth. Exposures can happen in very experienced hands. And the goal should not be making people feel ashamed. It should be making sure the response process functions consistently and safely.
And that changes the emotional atmosphere immediately.
Completely.
Whereas fear usually creates hiding behavior.
Oh, absolutely. Something else that matters a lot is consistency.
Mhm.
Healthcare workers notice very quickly if support changes depending on who is supervising, how busy the shift is, or how stressed leadership feels at the moment.
For sure. Inconsistency damages trust really quickly.
Oh, very quickly.
I also think operational support plays a huge role here too.
Oh, yeah, absolutely. Even supportive workplaces can unintentionally create barriers if the reporting process feels overly complicated or disruptive. If someone has to track down multiple people, repeat the story repeatedly, or leave the floor for long periods during a chaotic shift, the process itself starts to feel stressful.
And people begin associating reporting with frustration before they even start it.
Yeah, absolutely. Which is why reducing operational friction is such an important part of safety culture.
One thing that stands out to me is how healthcare organizations sometimes focus heavily on technical education while overlooking emotional environment.
I completely agree.
Because strong safety culture makes transparency feel safer than silence.
Couldn't have said it any better. One thing I think is really important for leaders to understand is that support after an exposure often involves much more than just medical evaluation. It also involves clear communication, follow up, checking in with the staff member, and making sure people understand what happens next. Sometimes even small supportive actions can significantly reduce stress during these uncertain situations.
Even simple check ins can make a huge difference emotionally.
They really can, because at the end of the day, healthcare workers are still people
Mhm.
navigating stressful experiences inside a very demanding environment. And the way organizations respond during those moments shapes how safe people feel being transparent in the future. And I think one of the emotions that surprised me the most after my own exposure was actually anger. Not just fear or uncertainty, but anger.
Mhm.
Because after the incident, I became very focused on the fact that the exposure felt preventable. And what frustrated me afterward was realizing how easily workflow speed and convenience can sometimes become prioritized over employee safety in healthcare environments.
That would frustrate me too, and that probably changes the emotional experience completely because now the situation doesn't just feel accidental anymore.
Exactly. It shifts from something unfortunate that happened to Could this have been prevented if safety concerns had been taken more seriously earlier? Because sometimes what creates the deepest emotional impact is not just the exposure itself, it's the feeling that preventable risks were tolerated beforehand.
And once healthcare workers start feeling like safety concerns are not genuinely prioritized, trust in the system starts eroding quickly. And over time, that absolutely shapes reporting culture overall.
Exactly. And when healthcare workers feel safe speaking openly, safety systems become much stronger. So, after talking through the emotional side of exposures, uncertainty, underreporting, and workplace culture, I think it's important to leave people with a few practical takeaways that can be brought back into their own clinical environments.
Because these conversations really do affect how people experience safety day to day.
Absolutely. I think one of the biggest takeaways from this conversation is that exposure events are never purely procedural experiences. Even when the clinical process is straightforward, the emotional experience can still feel very significant for the person involved.
Especially because uncertainty affects people differently. Some healthcare workers may appear calm outwardly, while internally they're carrying a huge amount of stress.
Precisely.
Most notably, small actions can have a much bigger impact than people realize. A quick check in, clear next steps, simply making someone feel supported instead of judged.
Those things matter enormously. Another important key takeaway is that reporting an exposure should never be viewed as a personal failure. Exposures can happen in very experienced hands. What matters most is responding consistently and appropriately afterward.
And I think that that distinction is really important because a lot of healthcare workers immediately internalize exposures as evidence that they did something wrong.
Absolutely, yeah. Strong safety culture is built through supportive leadership, consistent response, clear communication, and environments where transparency feels safe, not environments where people feel embarrassed for speaking up.
And healthcare workers influence each other a lot more than we sometimes realize. New staff are constantly watching how exposures are handled, how supervisors respond, and whether reporting feels encouraged or discouraged in practice.
Exactly. Which means culture is built through everyday interactions, not just the written policies. And I think one of the healthiest shifts organizations can make is moving away from blame centered thinking and towards support centered response. Because fear and shame usually decrease transparency, support increases it. Stress changes behavior, whether someone works in healthcare or not. People experience fear, uncertainty, embarrassment, stress, and emotional reactions, even when they understand the science and know the protocols. And acknowledging that human side doesn't weaken professionalism, it strengthens safety culture. And hopefully, conversations like this help normalize the reality that exposure experiences can affect people emotionally, not just clinically, because both sides matter. Kirsten, this was such a thoughtful conversation, and I'm really glad we were able to talk through this topic in a more honest and realistic way.
Me too. I think that these are conversations healthcare workers need more often, especially conversations that acknowledge both the clinical side and the emotional side of safety culture.
Yes. And because strong safety culture isn't built only on protocols, it's built on how people are treated during real moments of stress and uncertainty. Thanks for listening to Vitals and Veins, the podcast where we explore the real world practice of patient care from the point of view of allied health professionals.
And where we talk honestly about the human side of healthcare.
In our next episode, we're going to continue this conversation by taking a closer look at how healthcare workers interpret exposure risk and why the exposures that feel the scariest emotionally are not always the ones carrying the highest clinical concern.
Because perception, fear, and actual risk are not always the same thing.
Exactly. Until next time, this has been Vitals and Veins.